In India, more than 10% have common mental disorders like depression and anxiety, and 150 million people are in need of care. Mutyalu is one of them. She lives in a small village in South India. Since her parents died recently, she has been suicidal.
పెళ్ళి ఎప్పర్లైందండి 11 సంవత్సరాలకు పెద్ద మనిషినండి అమ్మనే పెళ్ళి అయిపోయింది ఆ అబ్బాయి మంచోడు కదండి తాగుమోతాడండి.
There are very few mental health professionals in India, and it is therefore practically impossible for Mutyalu to get any treatment. To meet this problem, the George Institute has introduced Smart Mental Health, which upscales an alternative healthcare workforce to bring mental health care to the vulnerable population. It focuses on common mental disorders affecting the community like stress, depression, anxiety, and increased suicide risk. Pallab Maulik is the principal investigator behind the intervention.
It is just impossible to have psychiatrists or psychologists in each and every village of our country. We need to have other ways to provide that care to the population.
The intervention has three main elements. First, an awareness and anti-stigma campaign, then a screening program, and finally, mental health counseling by specially trained doctors. Let's go a bit more into details. The first element, the awareness and anti-stigma campaign, create knowledge among the villagers about mental health. Siddhartha Devapalli was one of the researchers involved.
We distributed pamphlets and brochures to each and every individual in the village by visiting each and every household in the village. Apart from that, we have staged some dramas. Those dramas are based on the mental illness.
People with mental disorders are often victims of heavy stigmatization of other villagers. The awareness and anti-stigma campaign are therefore essential to create acceptance and understanding amongst the villagers about mental disorders. After the campaign, the villagers are screened for mental disorders. The screening is done by community health workers who already live in the villages. The healthcare workers learn to use an advanced screening app, which can measure the villagers' risk of having a mental disorder.
ఇలా చేయడం తప్పు. ఏదైనా సమస్య ఉంటే మనమే పరిష్కరించుకోగలిగేలాగా మనం ఆలోచించాలి. దేవుని ఇచ్చిన జన్మ మనం వృధా చేయకూడదనేసి వాళ్ళకి అర్థమయ్యే భాషలో మేము మాకు చేతనైనంత వరకు మేము మోటివేట్ చేసాము.
The last element is about making mental health counseling and medication available to the villagers. A group of primary healthcare doctors is therefore trained in performing mental health diagnosis and counseling with the help of an app. The app makes it easy for them to diagnose and choose the right treatment.
Because of that questionnaire, we can conclude the diagnosis very easily and make them understand very well about their problem and about the treatment, and easy to counsel them also.
As part of the intervention, the doctors travel to the villages after working hours to see the patients. This was important as the villagers typically are not able to pay for transportation and to take a day away from the job to get treatment. To secure treatment adherence, the community health workers make follow-up visits with the affected villagers, and voice messages with medication reminders are sent to them as well. The project has proved to be successful in securing mental health treatment to the vulnerable population, and maybe more importantly, the level of awareness about mental health has increased.
Major impact that we could see is the level of awareness has increased among the population about the common mental disorders, and the stigma attached to mental illness was also addressed to a great extent. Now they don't need to hide the problem, which was the situation earlier.
The next step is to make an even more comprehensive research project.
What we have done till now is a large pilot study. What we really need to do as a next step, and which we are planning to do, is to do a large randomized controlled trial. So this would be a much more robust study, and the results of it which would give us a better understanding of what works and what doesn't work, as well as provide us an idea about what's the cost effectiveness of this study.
For more details, please visit georgeinstitute.org.in.